Tom Yamas is in Central Park, where that emergency field hospital is being set up. Good morning, Tom.
Robin, good morning to you. As you know, Central Park is an oasis for so many that live here in New York City, and now it's going to be a place where people are brought hoping not to die. And Robin, I got to be honest with you, when we drove in here this morning and you see these white hospital tents, it really hits you. This is Central Park, and this is a field hospital. The group Samaritan's Purse hopes to have it up and running by tomorrow. They're going to have 68 hospital beds, and Robin, they tell me they will be treating COVID-19 patients.
This morning, America dealing with a new, longer timeline. This after a major reversal from the president, extending social distancing guidelines to the end of April.
Nothing would be worse than declaring victory before the victory is won. Therefore, we will be extending our guidelines to April 30th to slow the spread.
The new date several weeks past Easter. A deadline he touted several times last week that he now says was aspirational. As the number of confirmed cases of COVID-19 skyrockets coast to coast, health officials estimating there could be millions of cases in the United States and between 100,000 to 200,000 fatalities. The president's new guidelines come as some governors are discouraging residents from coronavirus hot zones from entering their states. In Florida, checkpoints to screen New Yorkers driving in, while the Rhode Island National Guard began door-knocking homes, mandating that all out-of-state visitors self-quarantine. In Texas, travelers from major cities and drivers from neighboring Louisiana now required to quarantine for 14 days. Louisiana did see a one-day slowdown in confirmed cases, but the governor warning they are in a dire situation with a lack of supplies for hospitals.
We are playing catch-up, there's no doubt about that, and it moves fast.
In New York, EMS reporting record high call volumes, saying the last 5 days have been their busiest ever, with more than 6,000 911 calls a day. This morning, nearly 5,000 members of the NYPD are out sick, and nearly 900 have tested positive for COVID-19. 260 firefighters have also tested positive as well.
This is unprecedented. We've never seen our EMS system get this many calls ever.
With growing PPE shortages, healthcare workers like South Carolina critical care nurse Meredith Johnson say they feel unprotected.
I did sign up for this, but I didn't sign up to do it without the right equipment. I didn't ever expect to be in a position where I would be sent to work and literally risking my life.
The battle against the virus also taking an emotional toll. Nurses providing that critical link between patients and their families.
I just came from a patient's room. He's actively dying, positive diagnosis of COVID-19, and his family can't come, so I had to FaceTime his family, and it was just so heartbreaking.
Those on the front lines also fighting for their own lives. Dr. Arnold Wegg, a 63-year-old, 30-time marathoner, now on day 6 in a New York ICU after his family says he contracted COVID-19 from one of his patients.
He's receiving a lot of oxygen support to continue breathing.
The pandemic inspiring a call to action for retired doctors like Dr. Jane Bedell, a 63-year-old cancer survivor who came out of retirement to volunteer with the New York City Medical Reserve Corps.
I have, a credential, a New York State medical license, and I have experience. And so I can, even as a retired person, give back.
So many powerful stories like that all across the country. We also want to mention this morning, health insurers Cigna and Humana are saying they're waiving all copay for coverage related to COVID-19. And one more bit of good news, Governor Andrew Cuomo says that New Rochelle lawyer, the one he calls Patient Zero, who was at the center of that cluster in the New York City suburb, has left the hospital and is now recovering at home. George?